If you're a human, you're an athlete. Now, a lot of my patients disagree with me, but they come into the office and they'll say things like, hey, I see a lot of photos of athletes on the wall. It looks like you treat a lot of athletes. I don't consider myself an athlete. Just because you never played professional sports doesn't mean you're not an athlete. Whether you're a weekend warrior, a corporate warrior, pickleball, pick your recreation, the human body is an athletic machine. And one of the things that separates elite athletes is they view pain differently than the average person. So athletes are very connected to their body, and rightly so. It's their job. So they've been in and out of injuries, and they learn over the years how to differentiate from tightness and soreness and a little bit of stiffness that's a result of just a hard workout versus real injury and the stiffness that comes with joint dysfunction. So they're really good about knowing their body. And one of the things that I see with patients is they don't have the ability to discern pain that's just day to day from accumulation of activity and the pain that's a warning sign that there's something going on in your body. So sequencing matters when we look at how we look at the human architecture, okay? And this is so important that I wrote a book about it. It's called Only One Body, and it's a primer on the human architecture, how our body's built, how we move, how we break down, why we break down, and what do we do about it when we do break down. And elite athletes are already doing this. They know how to recognize the warning signs when they've just had a few hard weeks of work and they need to recover more, or they've got an impending injury that's probably going down the wrong path. So when we look at an integrative approach, we're going to look at the anatomy as a whole. We're going to prioritize the soft tissues and fascia, particularly nerve entrapments. 80% of the symptoms that we see in clinic are due to a nerve entrapment on some level. Next, you need to prioritize joint alignment. If you don't have good structural alignment, you're just building strength on top of dysfunction, and you're loading your spine and other joints in a way that's going to lead to poor movement, further injury down the road, and even arthritis. And lastly, we're going to round that out with rehab. Proper strength and stability after we've addressed the first two. So that's what elite athletes get, that a lot of us, it remains elusive, is their ability to know how to spot stiffness that's due to a joint dysfunction that needs immediate care, and they get in for frequent chiropractic care immediately. Chiropractic is usually a mainstream for their recovery and performance training. So if you've got stiffness that you've been trying to work out and stretch and it's not going away, get in to see a professional, get it looked at, and get somebody who can connect the dots for you and get you on the path to health.